hand raises, I got some chats. Thank you there. Hi, and welcome to Globant's webinar today. We hope that you are safe and healthy and at home. The reason for this webinar is that we've been hearing from many clients that COVID-19, this whole crisis has been and continues to be a struggle for them, regardless of their industry or digital maturity levels. Organizations are struggling to know how to act for the best of their customers and for the best of their people. So that's why we've synthesized and kind of summed up the most essential elements of our experience in managing distributed teams throughout the world, and also the digital tools that we use every day in order to facilitate that. These are uncertain times, and organizations would be really wise to avail themselves of all the tips that make it possible for us to move forward confidently out of our comfort zone. In this webinar today, we will be covering certain topics, the first of which would be learning about COVID-19. What is it in simple and direct language from a trusted expert, and more delving into the importance and validity of social distancing, kind of looking at it from the numbers. And then we'll delve into a survival guide for business continuity, focusing on core processes, using technology to make everything more simple, and also focusing on your people, protecting and empowering your teams and strengthening relationships through this time. So we're really excited to get started with that. First up, I'd love to present Dr. Carlos Bueno in chemistry and his PhD in Virology from the University of Buenos Aires. And he will be talking to us about COVID-19. Thank you, Carlos.
Thank you very much for your kind presentation. And well, let's talk about coronavirus. I will start talking about general topics about this virus. So coronaviruses, comprise a vast family of viruses known to cause disease in animals and humans, 7 of which are known to cause disease in humans. Coronaviruses have been known since the 1960s, and 4 coronavirus species are prevalent and typically cause mild respiratory diseases like common cold symptoms every year. But 2 other strains jumped from animals to humans. Severe acute respiratory syndrome coronavirus, SARS-CoV in 2002, and Middle East respiratory syndrome coronavirus MERS-CoV in 2012. These 2 strains have been linked to sometimes fatal illness. SARS with a mortality rate of 10% and 37% for MERS-CoV. These are really high mortality rates. For example, influenza has a mortality rate of 0.1%. Given the high prevalence and wide distribution of coronaviruses in animals and humans, and increasing human and animal activities, novel coronaviruses are likely to emerge periodically in humans owing to frequent cross-species infections. And this was the case that December last year, a series of pneumonia cases of unknown cause emerged in Wuhan, China, with clinical presentation greatly resembling viral pneumonia. And there was, on 7th January, the diagnostic analysis indicated a novel coronavirus, which was named Severe Acute Respiratory Syndrome Coronavirus 2. The disease caused by SARS-CoV-2 was officially called Coronavirus Disease 19, COVID-19. Viruses and diseases, they are called differently. For example, HIV is the virus that causes AIDS. Thus, this is a new strain that was discovered last year and has not been previously identified in humans. Given the SARS-CoV outbreak and MERS-CoV outbreak in the past years, this new outbreak is the 3rd coronavirus to emerge in human population in the past 2 decades. Early reports have described COVID-19 as clinically milder than MERS or SARS in terms of severity and case fatality rate. Thus far, the fatality rate for COVID-19 appears to be around 2% or even lower, but we won't know it until outbreak is over and serological surveys are done. In general, symptoms of COVID-19 are non-specific, meaning they are observed with many viral infections, for example, influenza, adenovirus, and even other coronaviruses. And the disease presentation can range from no symptoms to severe pneumonia and death. Common signs include general weakness, cough, fever, shortness of breath. These are the main signs that you will find with this disease. Some patients had headache and diarrhea, and in more severe cases, infection can cause pneumonia. People generally develop signs and symptoms, including mild respiratory symptoms and fever, on an average of 5-6 days after infection, and the mean incubation period 5-6 days. Importantly, most people infected with SARS-CoV-2 have mild disease and recover. Approximately 8% of laboratory confirmed patients have had mild to moderate disease, and 6% are critical. Based on available evidence, children do not appear to be at higher risk for COVID-19 than adults, and that's good news. Older adults and people who have severe underlying chronic medical conditions like heart and lung disease, diabetes, seems to be at higher risk for developing more serious complications from COVID-19 illness. And this is the higher risk, and we must pay attention to these people. Importantly, immunosuppressed patients, such as transplant patients, are also at higher risk. That is why governments and agencies are recommending measures to limit gathering and travel. If everyone takes this seriously, we can limit the number of infections. We should think of the lives you will save of older people and the high-risk people who are most at risk for serious disease, and adopt measures in order to prevent the spread to this population. For example, letting this population working at home. So take care of your health and protect others by following these recommendations. The most important to protect yourself and others, if you think that you have been exposed to COVID-19 and develop fever and symptoms, call your healthcare provider and stay home. That is quite important. Besides, there are other steps to take care. For example, clean your hands often, much more often than you have been doing until now. Wash your hands with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose or coughing. If soap and water are not really available, use a hand sanitizer that contains at least 60% of alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. This is quite important. Clean your hands often. Besides, another important point is to avoid close contact. Avoid close contact with people who are sick, and put distance between yourself and other people. This is especially important for people who are at higher risk of getting very sick. These points are very important because the best way to prevent illness is to avoid being exposed to the virus. One of the most important ways the virus is thought to spread is mainly from person to person, between people who are in close contact and through respiratory droplets. So we can observe in the next slide that avoiding close contact and social distance is so important because what we want is to flatten the curve. Why is that? Because the healthcare system has a capacity, and we don't want to saturate the healthcare system. So what has happened in China shows that quarantine, social distancing, and isolation of affected population can contain the epidemic. This impact of COVID-19 response in China is encouraging for other countries to do these measures. At present, for mitigation is voluntary plus mandated quarantine. These measures prevent transmission from symptomatic and non-symptomatic cases, hence flattening the epidemic and pushing the peak further into the future. And that's what we want. And we can observe the right how in China they slow down the progress of the disease and the spread of disease with these measures and social distancing. And in this next slide, we can observe that how different measures of social distance from free to all to extensive distancing impact in the spread of the virus. Early self-isolation, seeking medical advice remotely unless symptoms are severe, and social distancing are key to keep this and not to spread the disease. Besides social distancing and cleaning your hands quite often, also there are other important steps in order to prevent the spread of the virus. For example, cover coughs and sneezes, cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. This is quite important because after you sneeze, you should wash your hands. Wear a face mask if you are sick. You should wear a face mask when you are around, for example, other people and before you enter the healthcare provider's office. But if you are not sick, you don't need to wear a face mask. Face masks may be in short supply and it should be safe for caregivers. Besides, it's important to clean and disinfect. Clean and disinfect frequently touched surface daily. This includes tables, light switches, desks, phones, keyboards, toilets, and sinks all the time. If surfaces are dirty, clean them. Use soap and water before disinfection. This is quite important because if the surface is not clean, the disinfectant will not act. To disinfect, the options include dilute your household bleach or alcohol solutions and ensure that it has at least 70% of alcohol. So you don't need anything else. These are the way you should, this is what you should do in order to prevent the spread of the disease. Besides, there are simple and specific recommendations in order to prevent the spread of COVID-19 in your workplace. For example, make sure that your workplace are clean and hygienic. For example, surfaces like desks and tables and objects, telephones, keyboards need to be wiped with disinfectant regularly. That's much more often than you are used to. Promote regular hand washing, put sanitizing hand rub dispenser in prominent places around the workplace. Make sure these dispensers are regularly refilled. Display posters or digital promotion for hand washing. And combine this with other communication measures, such as offering guidance from occupational health and safety officers. Make sure that staff, contractors, and customers have access to places where they can wash their hands with soap and water. Promote good respiratory hygiene in your workplace. Display posters promoting respiratory hygiene. Combine this with other communication measures, such as offering guidance from occupational health and safety officers, and ensure that paper tissues are available at your workplace for those who develop a runny nose or cough at work. Anyone that with even a mild, a common cold or low-grade fever, importantly low-grade fever, should stay at home. Keep communicating and promoting the message that people need to stay at home even if they have just mild symptoms. Display posters with this message and make clear to employees that they will be able to count this time off as sick leave. And importantly, if it's possible, promote working from home, fundamentally for people with high risk of disease. Otherwise, should implement all these measures. And just finishing, these two slides are from WHO, and they inform about the importance to follow accurate public health advice and follow the news on latest coronavirus updates, but from accurate public health advice. Avoid social media and rumors that are not based on scientifically. Be supportive, be careful, be alert, be kind, and be ready to fight COVID-19. Thank you all for this.
You're welcome. Thank you very much, Dr. Carlos. This has been great insight. And yeah, we have people who are sharing their questions as we go. That's a good reminder. The Q&A chat is a good opportunity for our question and answer session at the end. We will be selecting questions from the Q&A chat window to make of any one of the presentations that you're about to see. So keep feeding in those questions. And thank you very much, Dr. Carlos. Now I'll hand it over to Pablo, who is our studio partner of the Agile Delivery Studio. And we'll be talking about the processes and management that makes business continuity possible. Is that correct, Pablo?
Yes, that's correct. Thank you, Anna. And of course, thank you, Dr. Bueno, for all your insights on COVID. I know that it may sound like we have been hearing same messages or similar messages for a while, but really it's very important that we all understand how to identify symptoms and to know how to prevent spread and how to get everyone that are around us as safe as possible. And in moments like this, you realize how the only way to fight back COVID or things like this is responsibility of everyone. So we are really responsible of how this evolves in our communities. So it's very important that we keep talking about this and that we keep everyone safe around us. So as such, and knowing how to survive the crisis, we think that it's important to go over some key aspects on guaranteeing the continuity of our business, but also the safety of our people, their families, and the clients. And one of the first things that we have identified and done to do this was to create our crisis committee. And this committee, the crisis management committee, must be fully empowered by the CEO. It has to be formed by the most senior management in your company, probably the number one of each of the C-suite, because you will want these people to be able to make decisions very fast. Things evolve so fast that in the same day we need to think of new items that we need to deal and face and approach and keep everything up to date. So it's very important that this committee is really empowered and is able to make these decisions, and they are reliable decisions. So within that committee, what we call the crisis pod, we are addressing this important matter the same way that we address any of our projects, by building a multidisciplinary team, and that in that team you have everyone that is key to be represented. And in our case, we selected people, someone from the people department, someone from the infrastructure department, someone from the communications department, someone from the legal department, and the operations. In operations, this is, of course, this is your main part of your business. So in your case, it may mean something different. In our case, this comprises technology, of course, delivery, but also capacity management. So all our talent, on how we acquire the talent and how we assign the talent and so on. So it's, in our case, it's not one person, it's 3 people. But you will also need, and this is very important to understand, you will need external experts helping you. Within our crisis pod, we have an epidemiologist, and this is because within your organization, you know what you are about. But in this case, you need a lot of expert advice on how to react to things, how to interpret some of the messages, and so on. So, for example, in our case, one of the first things that we did was to create a protocol on how we are going to address critical moments, such as a representative case within our offices or our teams, or a confirmed case. And this expert has provided us with a lot of advice on how to deal with that. And if you see, since we were lucky enough, I have to say, to be able to move this to a home working mode, we are in close contact, and the way that we do that is by way of our cameras and by way of our computers. But we are still in contact, and we are still addressing this situation very close as it is. So how you put this crisis management committee or this crisis pod in motion? The way we do that is, the way we did that, this is again following this similar approach as we do with our projects. Is we gave it an identity, we put a name. In this case, it doesn't need to be a fancy name. It's just COVID-19, but it has to have a name. It has to have a face. It has to have a someone that is very well reputed among the organization globally. I mean, in our case, we are present in many countries, and we are present. And we have over 10,000 or 11,000 people. So you need to make sure that everyone knows that person and that has a reference of that person. You need to have a way to reach the pod, your crisis pod at yourdomain.com. You have to, well, what we did was also to create a chat room that is always available, so everyone can ask for things. But we have seen a very nice reaction to this chat group, where everyone is collaborating and bringing new information, new developments in their community. So everyone is also available to get updated but in a collaborative way. It's not on a one way. And also, of course, we have our dashboards and how we monitor the evolution of the situation. And the last thing that we strongly advise is to centralize the communication. In our case, we build a website, very simple but thorough website, where everything is included there, and so everyone knows that they can go there and see what's new. And I think this what's new aspect is very important. So you need to keep it updated, and the reason for that is because you want people to feel that they are being taken care of, that we are really doing everything that is in our power, at our reach, to bring safety to them, but also to bring continuity to our business, because it's everyone's it's in everyone's important to guarantee that. So that's the first thing that we did. So we set the crisis management committee, we introduced it. We have been sending emails pretty often the very beginning of the outbreak, at the very beginning of the year, and when the countries where present started to show more spread of the disease, we started to increase the frequency and increase the messages to a point that, for example, we started with Q&A twice a week, and now we have Q&A sessions every day. And you realize on the things that pop during that Q&A session are the things that have been going on in the past 24 hours. So at a certain day, if there was something happening in one country, then most of the people from that country will join the session and they will be asking about that. And the next day, maybe there has happened something happened in another country. So all the other people from the other country join, but you really have this feeling of people wanted to be in touch, wanted to be updated, and you want people to also feel that the company is really doing it because you are doing it. And if you are doing it, why not giving the visibility of this going on? So the next thing that must happen, and if it hasn't happened in the past, you must be already thinking about it, is about how you are able to go remote. You will be able to go remote if you are very cognizant of your core processes. So what makes me, what gives me the ability to give continuity to my business? And in this case, it will not only be what drives, what allows you to send an invoice to a client. In our case, we need to make sure that we keep hiring people and talent is onboarding to the company. But still, we were used to do it physically at the office. We now move it to a virtual way of doing this. People had to sign many documents, so now all signatures are virtual. But you know that many of these processes that are core, not all core processes have to do with sending an invoice and collecting. Of course, it has to do with that, but it has to do with much more than that. So anything that drives value within your organization into a stream that ends up in revenue will be part of your core processes. The next thing that you're going to do, of course, not all core processes can be changed in 1 minute at the same time. So you need to find a way to prioritize that. And you will need to have a way to assess the business impact of each of these processes. And the impact can be revenue, but can also be legal liability or exposure. It can also be your company brand, your customer satisfaction, your employment brand. So all the things that how these processes, if they are not done or they are not done correctly, can have an impact on your business. I don't know, for example, in times of crisis, what will you be trading off between making payments to your payroll or doing the annual performance assessment? Well, maybe the annual performance assessment can wait until we have a way to do it remotely. But payroll, that's something that needs to keep happening. I know, things like that. And the last thing is on when you want to go remote and you need to do it maybe from one day to the other. I don't know, for example, we learned on Sunday, we learned that in Peru, everyone went to quarantine, mandatory quarantine that midnight. So no one would be able to work at the premises the next day. We had to do it like at that moment. So that means that in your processes, you will focus on outcome. You will not be focusing on having them perfect. You will not be focusing on making it sound or bureaucratic, or I don't know. You will need to make lots of compromise between what you need to accomplish, which is the outcome, and your ability to continuing providing business, rather than making everything that you do. And I mentioned this because the first thing that you think of when you go remote is, I need to move things to the cloud. I need to move things out of my infrastructure. I need to create to buy a new digital tool. Okay, maybe that takes time. Maybe 3 days, and you cannot afford 3 days. So you need to really do that now. And in our case, we had to deal with to giving some assets to people that need to keep working on Monday. So people had to receive those assets, and you, on a general day, you will do like inventory and making people sign and things like that. Well, in this case, you need to be flexible enough to be touching those processes in a way that you can keep going, keep providing business. And the last thing that I wanted to mention on my part, and because that represents where I'm coming from, which is delivery, and I have been doing delivery for the past 20 years, is that remote must not mean detached. I mean, your people will be suddenly from one day to the other, or maybe you have a week of preparation or whatever luxury you have in preparation time. It doesn't mean that once they go remote, they have been lost from what is going on in the company. And I know that Sanja will be speaking a lot about that. But you need to make people feel that they are still part of the collective, and that there's they know what they need to do. So we are saying here that they need to have alignment. You have to have very strong leadership. You have to make them know exactly what they need to do at any moment. You need to feel them that they are part of a unit, as a team, that whatever one does, the other one needs it, like the dependencies that they have between them, and that needs to have a way to be visualized, enforced, and so on. So you will need a lot of new tools that you may not be used to, but you need to train people as fast as possible, and also to have a communication plan where everyone is in sync with what's going on in the project or in the company. So I don't know, daily meetings where everyone checks in and says what they are doing. People not getting blocked and not saying anything to anyone. So it's very important that there's conversation going on. When you're at a physical office, you hear a conversation and you know that you need to chime in because what they are speaking about is important to you, and you know something that is important to them. Well, here you need to create a chat room and make everything in a way that it's fun, and it's also collaborative, and it's also a way where everyone is able to interact and give their part of the activities, because you want them to feel as important as they are for what they are building or doing within your organization. So I won't go much further here, but I will be up for questions after that. We will now be talking a little bit about the infrastructure and more that part that also needs to be addressed. So on to Seba.
Thank you, Pablo. And thank you, Dr. Bueno, as well. Hi, everybody. In the next 2 slides, I would like to provide some details with real examples about 2 important aspects for the successful management of a crisis like the one we are facing today. Before I move on, let me try to highlight something very, very important here. We all need to have an entrepreneur role during this type of situations and challenge every belief we have. Let me give you an example to clarify this. In my cybersecurity role, I receive a lot of questions about security and compliance. Actually, I think we already received one question related to that. And security and compliance are still very important, still in crisis time. I found many examples, especially in the financial market, of misunderstandings about regulations that were preventing specific tools or specific type of access for users. So we have to challenge everything we have in mind. Every company has a business continuity plan, but not every aspect from the plan is covered as it should. While business continuity planning has traditionally focused on failover, disaster recovery for the data center, this is only part of the picture. In our understanding, the user has a center role. I mean, the user impacted by the core processes. And from there, we identify the tools, applications, and devices. So we focus on the user first. As Carlos previously explained, the World Health Organization has specific recommendations to minimize travels, to reduce density, to maximize social distance. And many companies are translating this into work from home policies. Under this situation, companies must find options to minimize disruption for the business, maintain security, and support uninterrupted productivity for users and teams. I'm pretty sure we have another question related to that, so we will be answering those questions at the end of the presentation. Pablo already introduced how to identify and map core business processes, those that allow us to keep our business up and running. We need to match these critical users with the list of devices that they consume for the critical process. From this analysis, we need to understand if these devices can be moved out of our offices, if we have enough devices. Then we follow with applications. We need to clarify if those applications can be accessed remotely, and the same with the data. Let me highlight something very important here, which is the productivity. We really need to understand that the user experience is achieved in a level that we can keep productivity in a good way. Let me continue. So another thing, as Pablo described, the importance of core processes and so on. We continue here adapting such processes to be executable in a remote and distributed fashion. We begin aligning those core processes to the crisis situations. And sometimes this means to provide remote access to an application, but not always. Occasionally, this means to think out of the box. And let me give you an example here. Time ago, we had a customer using specific devices for application testing. Unfortunately, at that time, it was not an option for our Globers to take these devices at home. In this way, under a crisis situation, we had to evaluate different options, and we finally conclude that having fewer people at the office, only those requiring access to these devices, and a backup team ready was the best way to keep productivity while minimizing the risk. So even we talk a lot about remote access, that's not always the option. I mean, we need to analyze the process before we decide something related to the technology. As I mentioned in the previous slide, security and compliance are not optional. Sometimes policies include restrictions for key processes, which need to be adapted for these periods. Let me bring another example. We had a customer with specific location restrictions for people in charge of the Globant network. During a crisis situation, actually this policy was updated to allow these people to work from specific external locations in favor of business continuity. Based on this alignment, I mean the alignment of the processes, we need to check devices, apps, and data. This is something we will do with the crisis management team, the one Pablo described. We need every representative involved in these decisions. So we cannot take the decision just from a technological perspective, but we need all the team involved. We focus on quick changes first, changes that allow us to provide remote access to specific applications that impact on critical processes. These changes leverage on existing solutions, such as identity management for users and roles. If we have a gap, for example, users, applications, or data that are part of critical process and still not able to operate, we move to the second phase, planning and implementing tactical new solutions for them. There are typical solutions to address these gaps, such as providing remote access to physical desktops, new virtual environments for apps and desktops, approved devices for users, and new secure mechanisms to share information. Something also important here is the standard processes we have. Sometimes they must be relaxed because of the lack of time. And let me give you an example. Typical paperwork to get a laptop for one of our employees is simplified during the time of the crisis to get laptops available in a short period of time. So in summary, after the key business processes have been adapted to the crisis time and security policies have been aligned, we focus on implementing those changes that allow us to address key business processes, starting with those that rely on existing solutions and then moving forward with those that require tactical solutions. So this is everything that I have from an infrastructure perspective. Let's move on to the communication side. Sanja, let me pass the baton over you.
Thank you very much, Sebas. So it's a pleasure to have an opportunity to speak with all of you today. I'm an organizational psychologist, and in my role at Globant, I really focus on how do we leverage technology to make sure that our employees feel very well connected, that they feel appreciated for their work. We are an organization that functions in 17 different countries across 15 different offices. And so for us, it's really in our DNA to be able to connect remotely. But even as such, we're in unique times. And so the guys talked a lot about different processes and of course the health needs and how do people make sure that they're prepared for what's coming. One of the other aspects that we're really looking at is how do we make sure that our employees really feel connected, that they feel emotionally secure, and they still very much feel a part of a unit. So what happens oftentimes when you have an opportunity to work from home, and maybe that's not what you're traditionally used to, and some individuals are in the office, others are at home, you're distributed all over the world, you're looking for that way to come together. And in a lot of research and a lot of stories, you'll see people say that in a moment of crisis, it brings people together, and we're in a unique time that physically we can't do it. But in some ways, maybe we're a little lucky that we're used to technology because we can really leverage it to bring each other together. And so I wanted to share a couple of examples of what we're doing at Globant that I hope you can leverage in your organizations as well. And so one thing is we have an application where we share photos, and it's something that we've had for years. And usually we share photos of meetings, maybe happy hours, client visits. It's a different way to give individuals all over the globe a visibility into what's going on in the organization in a casual way, where you can imagine now a little bit with the change and how we're running our day-to-day, the photos are a little different. But what we did yesterday is we started to run a campaign, and it was actually kicked off by one of our co-founders with a hashtag that said, "Taking care, be kind." And in a lot of our research, we found that at Globant and in other organizations, employees are really eager to get to know each other better. They want to form closer relationships. It's something that they're really looking for. And so in this opportunity, we just launched this campaign yesterday, and it's absolutely incredible the amount of photos that we received from different Globers. And here I could just share a few, I could show you hundreds, but to me it brought a huge smile in my face, because at some point you may hear my son from a different room trying to chime in, but all of us are looking at how to make things work. We have a different reality right now, but we're opening up our doors to our homes and to our hearts and really sharing a lot of information that's helping us connect at a completely different level. So it's something that we've seen already have such a tremendous impact and make Globers, no matter where they are in the world, really feel like they're together and in some ways feel closer than ever before. So it's something that's worked really well for us. Something else is that at Globant, we're very driven by our values, and our founders define those just a couple of years after the organization was founded, and it's something that we very much keep in our hearts, so much so that we use a platform where we recognize all the amazing different behaviors that Globers engage in across the organization. And the reason why we wanted to build a digital platform is, again, that we're in so many different parts of the world, but there are so many incredible things that could be celebrated. And so if you go back real quick, so in that sense, what we wanted to do, or what we did, is as a part of this campaign to really fight against COVID-19, is we created a value that's called Be Kind, and we're recognizing all of the different employees across the globe that are doing the right thing. So we had this wonderful doctor share all different best practices, and we had Pablo and Sebas share practices around what the organization can do. We're asking our employees to change the way they work. And so we want to make sure that all of those different things are still very much celebrated, and that, again, through that value, through the behavior that we think is so important right now, that all the different individuals that are making an impact both in the organization and for themselves are very much visible and celebrated across the organization. So now if we jump to next slide. Something else that we wanted to make sure is, so I talk about technology a lot, and I think in some ways we are lucky that we're prepared and we're a digital organization, and so a lot of the technologies we're using are already innate to us. One of the things that I would encourage you is, when you're looking at different solutions, is to provide that positive digital experience across different employees. And so think about where the different individuals are located, what kind of access they can have, and sometimes it might be through a mobile phone, sometimes it might be through a screen at a plant or in an office, but to provide that different level of connectivity where people really feel the sense of unity. What that's going to do is it's really going to help with strong team dynamics. So again, more than ever before, this is a point in time where we're coming together, and as we were saying earlier, there's new information all the time. And so we have different communication channels, but also the better employees are connected, the more organically we help each other, the more we can reach out, the more, again, we feel that we're not in it alone. And once you have this connected workplace, there's, of course, a lot of research that says, hey, the better connected people are, the better they collaborate, the higher that performance is. And it's an interesting time for everyone that we are really preoccupied about what's happening. But for a lot of us personally, for a lot of our businesses, we're saying, okay, how do we continue to focus? How do we continue to push forward to make sure that once we come out of this, that we come out in a really good place and everybody is still enjoying what they're doing, that everybody still feels very productive, that we're able to really maintain as much normalcy in our work as possible. And so that's where technology and that connectedness can really have a huge impact. And something else, I focus on people analytics a lot, and you can see an analysis. One of the things that I would encourage you is, a lot of organizations have people analytics teams. Some organizations maybe have an individual that's been really wanting to do some analysis, but it hasn't been a priority yet. More than anything, I would encourage you right now, if you have an opportunity for somebody to look at the organizational dynamics, to do that. Because one of the things that we might see happening is we're so focused on the health, and we're so focused on operations, and we're focused on our people, and we're hoping to give them the ability to raise their hand and say, hey, I feel lost, or I feel disconnected, or I don't know if I'm able to do my job effectively because of the situation I'm in, and maybe I'm at home with 5 kids, and what do I do? And so one of the things that's really important to look at is these dynamics between people because what we as employers need to do is make sure that as we're going through this pandemic, that we're still creating that workplace and we're still creating that culture as much as possible where our employees feel connected and comfortable. So if we jump to the next slide, I will show you just a quick video of some ideas for the things that if you have different kind of data available, this is the recognition data that we use, the feedback data, the photos that I showed you. So what we looked at is one example of a team that works very closely usually in offices, right? So one of the questions that's top of mind for many people is, hey, maybe we have the ability for people to work remotely, but what if they haven't historically? And here we can see a group of our employees that very much tend to work in offices. And so we are thinking, okay, as this group starts to work from home, as individuals elect where they want to work, we want to make sure that they still feel connected because we know that that specific group is no longer going to be close physically. And then we looked at another group of individuals that's actually a little more geographically dispersed and used to working remotely. But what we also found is that not only during that time were they connected to each other, but they were connecting to different parts of the organization. So we're thinking that, okay, for us, it's good because our individuals that were working remotely, the technology that we enabled them with, we're already providing them with the ability to connect. So now we need to make sure to maintain that. What you can also see in the data is you may find areas where maybe people in the organization were not connecting as well, and that's where you need to put the extra effort. But all of this is about understanding your organization, how people are communicating, because we will give our employees all the technologies, we'll give them the means, we'll give them all the different communication with the goal of them feeling that they're still part of this organization, that they still have a lot of people that care about them. But also as employers, it's really important for us to make sure that all of the different ways that we're supporting them is working for them. And if in some cases it's not, what else can we do? But this real-time kind of data really allows us to adjust our strategy to make sure that as the situation is changing very quickly and as we're adapting our strategies, that we're doing the right things to support our employees globally. So with that, I will turn it back to Pablo.
Thank you, Sanja. So I will make it very short to sum up. The first thing is you don't have time, you need to take action, at least with this specific outbreak. It's happening. I mean, you need to do it. The second one is you need to be able to segregate what's real from what's not in terms of the information we receive from the health care part and the virus itself and so on. So make sure that you're using a proof source of information like World Health Organization. If you do it in a sustainable way, you have less liability. Some things will need to be compromised, but that's how it is when you need to react so fast. And the last thing is that we have prepared a playbook that you can somehow. You can reach it at continuity.globant.com. It's in the form of a playbook on how to address these times of crisis, and it has a little bit more information than what we have been sharing today. So that's as much as we had to share. I will pass it on to Anna for a wrap up, and that's it. Thanks all for your attendance.
Hi all, thanks again for your participation. I'm sorry that we didn't get time for the questions. There are a few key questions that we will be dealing with in the follow-up email, where we will also be sending you these slides that you've seen today and the recording of this chat. So thank you very much for your time and for your willingness to get together, however virtually today. And we wish you all the best in these next few weeks. Kind.
Thank you.
Thank
Stay
you.
safe. Bye.
Thank you.
Thank you.
Bye all.